Hello, everyone. Good afternoon, and thank you all for joining us for this conversation, Global Sexual and Reproductive Health Post-Roe, How Restrictive U.S. Abortion Policy Impacts Movements Abroad. This panel was co-sponsored by Women in Global Health Georgia and Women in Global Health DC. I'm Suba Narasimhan from Emory University, and I have the pleasure and honor of introducing our panelists. So, our first panelist is Nabiha Cassie Hutchins, who serves as president and CEO of PAI and brings more than 25 years of movement building, public health advocacy, and international development experience. Nabiha was born in Pakistan and raised in Mexico and has worked on policy advocacy and health education programs in collaboration with civil society and political leaders in more than 20 countries. She holds dual bachelor's in political science and journalism and mass communications from Kansas State University, and dual master's in international affairs and public health from Columbia. Thank you so much for joining us today, Nabiha. Our second panelist is Lucia Barro-Pizarroza, an associate and postdoctoral fellow at the O'Neill Institute for National and Global Health Law. In 2020, Lucia was awarded the Rubicon Grant by the Dutch Research Council to undertake a 2-year research project on sexual and reproductive health and rights. In 2019, she received a prize from the Dutch Network of Professors under the Distinguished Women Scientists Fund, and her work has been published in renowned peer-reviewed journals such as BMC International Health and Human Rights, Sexual and Reproductive Health Matters, and Harvard Health and Human Rights. Dr. Barro-Pizarroza holds a PhD in international law from the University of Groningen, Master Juris from the University of Oxford, and an LLB from Universidad de la República in Uruguay. She also holds postgraduate diploma in public policy design and a postgraduate diploma in women's rights from the Universidad Austral in Argentina. I apologize for my pronunciation. Thank you so much for joining us, Lucia. And I'd also like to welcome our co-sponsor and moderator, Lanice Williams, who's from the DC chapter of Women in Global Health. Lanice is a senior program officer at JPIGO, where she provides cross-cutting management and programmatic support for maximizing options to advance informed choice for HIV prevention, or MOSAIC. She has over 10 years of experience working in research, programmatic, and policy initiatives in the United States, Sub-Saharan Africa, and Latin America and the Caribbean. Prior to JPIGO, she worked as a gender integration specialist at Encompass, where she provided programmatic and technical leadership for gender and HIV programming in Lesotho for PEPFAR Dreams, GBV prevention and response, and gender integration. Lanice has also been published in numerous publications, and she's spoken as a panelist for Pathfinder International, Women in Global Health, and at APHA's 2017 and 2020 annual convenings. Her work on gender equality has been published in Ms. Magazine and Just Security. Thank you, Lanice, for moderating today. So without further ado, I'm going to let you kick it off and begin our conversation.
Thank you, Suba, for the warm introduction. I'm really excited to hear from our esteemed panelists today on what are some of the global implications, particularly since the overturning of Roe v. Wade. As we know, we're coming up on the 1-year anniversary of that ruling. So my first question I have for you, Lucia and Nabiha, is can you describe the scope of your work and your efforts, particularly around abortion, and how has your work, whether it's in the US or globally, been impacted by this reversal? Maybe we start with you first, Nabiha, and then go to Lucia.
Sure, thank you so much. And I want to thank you for this space. And it's such a pleasure to be here with Lucia, as well as with you, Lanice. So PAI, very briefly, we're a civil society organization. We were founded 57 years ago with the mission and the mandate to advocate for sexual and reproductive health and rights around the world. We hold our own government accountable, we amplify evidence, we speak truth to power, both here in the US and on the global stage. And we also support community-based civil society organizations in over 35 countries around the world. So partners around the world can do the same with their own stakeholders and leaders in their own countries to benefit their own communities. So we've long supported the right of all people to access not only abortion, but also other sexual and reproductive health services such as contraceptive access, access to comprehensive sexuality education, et cetera, working, of course, here with a lot of policymakers. And the reversal of Roe because of the Dobbs decision has certainly brought a new sense of urgency to our work. We need to highlight the ways in which these anti-choice decisions and the anti-choice rhetoric from the US, how it's being exported and interpreted around the world. And now I know we'll get to that, but I also think it's very important, and it's something that PAI does in its role, is taking time to praise champions and seed space for champions who are working to advance the global movement and reinforce that we are still a force to contend with, right? Very concretely, the kinds of things that we are doing, knowing that the opposition is loud and well-resourced, and our commitment to continuing not only to shine the light and to highlight the strong support for sexual and reproductive health and rights with members of Congress, with donors, with other critical stakeholders. Again, not all is lost. As I noted previously, we are still a force and will remain so, but we are working with congressional champions to show strong support for issues like permanent repeal of the global gag rule, which is a harmful policy which comes back into effect every time since the Reagan administration, which is when it was created, whenever a Republican administration comes into being. And even when Democratic administrations have taken office and repeal it, it's not a permanent repeal. Permanent repeal is really important because there's always lingering effects with the global gag rule. It doesn't ebb and flow and end or start in terms of harm with the comings and the goings of an administration. And the global gag rule restricts US funding to support abortion services overseas. The last thing I'll note in terms of our work in the US as it relates to globally is we certainly lend our support to legislation like the Women's Health Protection Act and the Equal Access Abortion Coverage and Health Insurance Act. These pieces would really codify a right to abortion care for Americans, and then, of course, ensure that people in this country can access and afford these life-saving services, which are very important. And on the global side is, of course, also fighting the Helms Amendment, also, which is a very restrictive US policy that affects US funds for abortion overseas.
Thank you for that, Nabiha. Lucia?
Thank you so much, Nabiha. Thank you so much, Suba and Lanice, for welcoming us today. It's just wonderful to share space with you and to be talking about this very topical matter and that keeps popping in the news. I am in the UK at the moment for work, and I keep seeing the new development in terms of mifepristone, but also activism in a series of other things. And I just wanted to kick off saying that, so I am originally from Uruguay. I am a lawyer by training. I have been working in SRHR for a long time at a regional level. And then I work a lot in Europe and in Africa. And as a researcher, as an activist, for me, this is an incredibly interesting time, right, to be able to document the bold activism that is very active, that it keeps growing in the US. So I came to the US 2 years ago to do a research project, and my focus initially was on networks of activists that were working, building on pillars of harm reduction, on human rights, on access to abortion, to provide outside of institutional systems access to abortion. And my focus was Europe, Africa, Latin America, right? And then when I get to the US and the landscape changes, I was kind of very surprised. I mean, not surprised, but like I was very happy given the opportunity to like also look and document the activities that are happening in the US, because I think for the first time in a long time the US is looking outwards, looking at other regions to see what activists have been able to do across other kind of like jurisdictions and countries, right? And it's an incredibly generative moment, and I know that this might sound a little bit like difficult to say, but like I think this backlash, these regressions that the US experiences, is also demonstrating that there were like certain cracks that were not working, even when Roe versus Wade was still the present, right? And the importance to look and link and foster this transnational activism that is just so important. I think is going to be so crucial in this moment.
Thank you so much for that. So the next question that I have for both of you. So Lucia, I know you're originally from Uruguay, but you've done a lot of work, particularly on the green movement in Argentina, Mexico, and a couple other countries. Would love to hear what are some of the global impacts that you're seeing on the overturning of Roe v. Wade? And Nabiha, for you, it'd be great to hear, I know PAI works a lot with civil society organizations in countries. So what are you also seeing from those organizations you're working in partnership with? So Lucia, we'll start with you and then Nabiha.
Thanks so much for this. And I want to start by saying also that like the impact of the US goes well beyond changes in the legal framework, right? I think even before Roe versus Wade, and Nabiha said it be like perfectly, the Helms Amendment, the Global Gag Rule, where, I mean, they subjected a lot of us in the Global South to the bipartisan politics of the US. It was extremely harmful. It like basically prevented organizations to be sovereign again about the work that they did and be able to provide the services that they wanted to provide just because they were receiving US funding. And at the same time, they couldn't use their own funds to work. These regulations, these policies kind of like disarticulated the movement because people working on HIV could not do abortion work because they were receiving this funding, right? So I just want to be very clear that the impact on other regions, like it's connected to Roe versus Wade, but it's also something that can like is sort of permanent in time. And the impact of Roe versus Wade has, at least in the way that I see it, and in the people that I'm interviewing at the moment that I'm working with, it's like on one hand, it emboldens anti-abortion and anti-right movements elsewhere. So a lot of us, whether we like it or not, we look at the US for guidance and example in many ways, but also cautious because it's a very powerful actor in the global landscape of SRHR in general. So I think in many ways, the funding streams that have entered to anti-rights organizations in Latin America, but also in Africa and Asia and other regions, is testament to how the US plays a little bit of like kind of like an invisible role, but at the same time very effective in kind of like emboldening and funding and using countries as like testing ground for a series of strategies, communication strategies, legal strategies, etc., are anti-rights, particularly because we must remember that this conversation is about abortion, but it's also much broader than abortion. It has to do with bodily autonomy. It has to do with people's right to control their bodies, their destinies, etc. And I think that's the end goal of the opposition that is funded and inspired and trained from the US, right? And I think the other impact that I find that is really interesting is like the changes in the US have created a reaction also in the global South, right? We were all sort of like, what is going to happen now with the US? This uncertainty is like very unsettling, but at the same time, it has articulated a response of solidarity from different parts of the world that I find extremely powerful, right? Like the Mexican collectives at the border, very much ready to support people that will need to travel, diaspora, like expats from the US located elsewhere, also organizing themselves to be able to support in whatever way, right? Like a lot of like demonstrations of solidarity that I think they're very needed, and hopefully are sending a signal to activists in the US that are doing the work in a very difficult conditions at the moment, that we are all together in this struggle. That is really important to keep connected and continue sharing the learnings and experiences from different regions, having working in similar circumstances for more than a decade, right? So there's a lot of learning to be done in that regard.
So I think I agree with everything that Lucia, you've said, and you've hit those points so well. And I think, you know, the other piece for us is we need to recognize that the United States is part of the global community. It does have, to Lucia's point, an outsized influence, not only the power of the purse, but also the power of the example of the United States. And the global implication, to put it really bluntly, it means that more pregnant people are going to be harmed, are going to die, or are not going to get other essential health care. Because we have seen and we know the data, and it's very clear that when safe abortions are banned or criminalized or inaccessible, abortions don't stop. What it does do is it drives people to have unsafe abortions, putting people in really vulnerable, risky situations, and that leads to harm, and it can lead to death as well. In fact, as many of my colleagues in this space know, and Lucia, I know you're tracking this really closely as well, is unsafe abortions are one of the leading contributors to maternal mortality and maternal morbidity around the world. And these numbers can be reduced. These morbidities and mortalities are entirely preventable. So in terms of the signals that it's sending, and not just the overturn of Roe, but also the signals, again, all over the news around the US's efforts to prevent access to the medical abortion pill, mifepristone. Of course, we're all seeing the headlines, but the conversation and the headlines are not limited to the borders of the United States. We're hearing and we're seeing that the example of the US, both on Roe, but also now with mifepristone, is that example is brought front and center in many countries abroad. It does fuel the opposition. It also fuels efforts to bring those who might be on the fence into the opposition movement, because again, they are very funded, and the opposition is penetrating other communities in very strategic, consistent ways. Not a one and done. Their opposition movement is constant. I think also a signal that is very concerning is that the United States, which is a democracy, it lauds human rights, it speaks to equality, it centers justice in its foreign policy and in our commitments and our rhetoric abroad. So if the United States has restricted access to abortion, which is recognized as fundamental health care, then other countries, other communities are asking, well, shouldn't we take the same stance? Given the US example. And it is fueling, as I said, the opposition. We had partners in this week from Zambia and from Malawi, and they were talking about how the fall of Roe really empowered the religious right in their own countries, as abortion opponents have now adopted these US pro-birth, quote unquote, pro-birth strategies, both from a legislative perspective, but also from a tactical perspective, doing these sidewalk counseling efforts, protests, crisis pregnancy centers, which really harm and manipulate people. We're seeing this in Uganda, we're seeing in Kenya, and so on and so forth, with so much money that's being funneled to these efforts through churches, and also from US and European institutions that are not standing on the side of recognizing that women and people should have the right to choose. They know what's best for their bodies and their futures. The last thing I'll say on this is these moves in the US have created a lot of confusion abroad. There is very much a sense that if US decisions for their own people extend to communities around the world, what could happen in terms of the ongoing access and dependency on US funding for health services, because the US is one of the biggest funders of global health and reproductive health. And with that, there's a lot of confusion. Clinics are turning away people who are pregnant out of fear of losing US funds, even in cases where abortion is legal or post-abortion care is legal in their own countries. Concerns that they might be in violation with US norms, that they might lose their funding. So these rulings in the US add to the confusion and strengthen misconceptions and misperceptions on what people can have and what healthcare providers should be doing, even when they want to be giving support.
Thank you so much for that. So Nabiha and Lucia, I know you talked a little bit about the US being on the global stage and decisions that happen in the US. What does it signal to other countries? Would love to hear a little bit more from you both on, like, as you know, like the US is looking at implementing Sustainable Development Goal 5 on gender equality, Sustainable Development Goal 3 on health for all, as well as we know they've signed on to international treaties like CEDAW as well as ICE SCR. And we'd love to know, like, how does this Dobbs ruling come into contention with some of those established treaties and some of the goals that are outlined in those treaties? Maybe start back with you, Nabiha, and then Lucia.
Sure, Lanice. So the Dobbs ruling stands in direct opposition to several sustainable development goals, which are goals that the global community, that governments committed to for the progress of people and planet. It also falls in contention with the Convention on the Elimination of All Forms of Discrimination Against Women that was signed in 1979 and is a global agreement that defines women's rights as human rights. And other agreements and policies. So bottom line is that there are a range of global goals, treaties, policies that were signed on to by governments, making commitments and promises to make the lives of people better, to make communities better. And the Dobbs ruling is in conflict with those internationally recognized commitments to health, to human rights, to women's rights, and more. But I think what matters the most, and perhaps most importantly, is that the Dobbs ruling makes the reversal of Roe, or which led to the reversal of Roe, makes it in complete conflict with the will of the American people. And I try and reinforce that at every turn. It's in conflict with the will of the majority of American people. This is not the American people's dominant decision. It also is in conflict with scientific evidence. It's also in conflict with what the global health authorities, the scientists, the doctors, the nurses, the community health providers, where it is recognized that abortion is fundamental health care and it is safe and it should be part of the healthcare package of people. The Dobbs ruling that reversed Roe, when I said it doesn't affect the majority of how people in the United States feel about this and want for themselves, the number is really clear. Between 70 to 80% of Americans believe that abortion should be legal. And the midterm elections in this country, starting with a state that I love and that I lived in for a very long time, Kansas, reinforced that, where efforts to ban abortion in the state of Kansas failed and other states followed suit. So that, I think, is very important. This is not a decision that the American people are in support of, and I think very much reflects the fact that this is not a decision, and banning or preventing access to abortion is not something, quite frankly, the global community is aligned to support. In fact, the director of the World Health Organization just this week, a few days ago, was in regards to the battle for access to medical abortion pill. He said, women should always have the right to choose when it comes to their bodies and their health. Restricting access to abortion does not reduce the number of procedures. It drives women and girls to unsafe abortions and death, and access to safe abortion saves lives. So I think all of this is very important for us to consider. We can talk about policies, we can talk about promises and commitments, but we have to listen to the people and make sure that our actions, our decisions, the care that we are providing aligns to the aspirations of people, and the decisions that are being pushed for in the United States do not reflect that, neither here nor the aspirations of people around the world.
Yeah, I mean, absolutely, I agree with everything that Navi had just shared. And I mean, the international human rights standards are very clear, right? Sexual and reproductive health are human rights. Part of them is access to the big spectrum of healthcare services, including abortion care, including post-abortion care, including contraception, including a series of other services. And that has been a development that has been done by UN treaty monitoring bodies, by organizations like the WHO, right, that have created this normative framework that also applies to the US. And I think something that I find extremely important is that, so the right to access abortion care and the violation of the right of that right also means the violation of a series of other rights: the right to health, but also the right to gender equality, the right to bodily autonomy, the right to decide on people's lives, and like the right, the recognition of the person as being like the experts on their own lives, the experts knowing what is best for themselves, what is best for their families, what is best for the community. Unsafe abortion, as Navi has said, it's this kind of like political crisis that is created because all of the deaths for unsafe abortion are preventable deaths. Abortion can be a very, very safe procedure, safer than many other things that we routinely do, right? But we have decided, or some societies have decided, some politicians have decided that people should not have access, with devastating consequences. And something that I feel that is really important to reiterate here is like, while the US is not part to some of the treaties, right? Like the Convention on Elimination of All Forms of Discrimination Against Women, and it's not part of like the Covenant on Economic, Social, and Cultural Rights. These are norms that applied nonetheless, right? These are norms that have become part of like how we understand human rights and apply to them. But something that I find very interesting, and I want to celebrate the activists and the policymakers that were behind this, is that the Committee on Elimination of All Forms of Racial Discrimination was very clear last year. Dobbs represents a violation of that convention because it has a disproportionate impact on those more marginalized. It is women of color, it is Latina women, it is people of like sex and gender diverse, the ones that are suffering with these restrictions. And I think it's really important to name this because not everybody is affected equally, right? Abortion restrictions have devastating consequences, but in so many ways, it continues to put the burden of having to navigate a very hostile scenario on those who are already marginalized for the healthcare system and are already targeted by criminal restrictions. So I think it's really important that we elevate this and that we are very conscious that when we talk about the impact of this has very disproportionate impacts on certain communities that should be protected by people like in power, and that should be kind of like guaranteeing the human rights to begin with.
Thank you so much for that. My next question that I have for you both is, how does this, the trends that you're seeing with the reversal of Roe v. Wade, how does it align with a lot of the global trends on abortion rights, where more conservative voices have been systemically trying to undermine global women's rights? So, we've seen progress in countries like Ireland, Argentina, Colombia, but we've seen setbacks in places like Poland, El Salvador, to name a few. So we'd love to hear your thoughts on that. And Lucia, we'll go to you first, and then Nabiha.
Yeah, so I think while in general and globally we see a trend to liberalize abortion, to recognize misoprostol and mifepristone as essential medicines, to embrace the potential of less medicalized models of abortion care. There are a couple of outliers, including the US, that have managed to adopt retrogressive measures when it comes to abortion rights and to healthcare. And I want to mention particularly Poland, because a very dear friend and colleague of mine has recently been prosecuted for supporting somebody to access an abortion during the pandemic. She has been prosecuted for intent to aid and abet an abortion. And this is in the context of an extreme violent state in which conservative forces have managed to basically install a complete ban on abortion. I don't know if you have been following the situation in Poland, but in 2020, the Constitutional Tribunal adopted a decision that imposes a basic, a de facto ban on abortion, because it bans the abortions on the ground of fetal abnormalities, which means that even before this decision was extremely difficult to access an abortion in Poland, and after this decision, it has curtailed those rights even more, forcing women and people with the capacity to gestate in Poland to have to travel abroad or to seek very unsafe methods, right, and invasive methods. And I mean, even in that scenario, I think it's really important to highlight how activists have remained relentless and have remained resilient and have worked really, really, really hard. But it's definitely a trend to pay attention to, because we see for the first time in Europe an activist being criminalized for her work as a women's human rights defender, as a person that is guaranteeing access to safe abortion in a country that refused to comply with its obligations to provide access to to access to contraception, access to maternity care, and access to abortion. And I think this trend of targeting those who are doing the work the state is neglecting to do and refusing to do, and actually endangering the lives and the health of everybody, is a trend that we must be very attentive to. And I think the other thing is that this the questioning of the safety of mifepristone is also a trend that is very, very dangerous, right? Mifepristone and misoprostol have been in the essential medicines list of WHO, the World Health Organization, since 2005, right? Our medicines that right now are considered to be so essential, so important, that are on that list and in the core list, right? Which at the same time, drugs that are considered to be so safe that people can take them without close medical supervision. This is the World Health Organization recognizing that people can self-manage an abortion using those medicines. So it is really important that we remain kind of clear that those are the international standards and that those must be upheld, and there's enough evidence for the WHO to consider those are essential medicines, and that are used all across the world with extremely successful results, right? Like in Uruguay, 98% of abortions are done with the combination of those drugs, and it has been extremely safe. It has changed the landscape of abortion in the country. So we must also be very wary of any attempts to limit or unduly restrict access to these drugs that are essential medicines. I hope I'm answering your question, Lanice. I feel like it has been such an incredibly complex landscape. It has so many kind of layers to it that it's so hard to answer a question like this, because there's just so many layers to the answer.
I was just looking at the chat because it's so much fun to see friendly names on the chat. So a shout out to everyone who's joining. I think the question on aligning with global trends, and Lucia raises some excellent points. bottom line is the move in the US counters what the global trend is. There's been so much attention and support and excitement around many of the movements that Lucia has noted, including La Marea Verde or the Green Wave movement. And if we go back several decades since the 1990s, about 60 countries have actually expanded their laws or their policies related to sexual and reproductive health and rights. I say expanded because still there's a lot of work to do in these countries. It's not full access to the comprehensive suite of support, but they have expanded and they're heading in the right direction. There are only 3 that have gone back to even more restrictive rules. Not only Poland, El Salvador, and Nicaragua, now we're adding a 4th with the United States. And there are countries that have decriminalized abortion. We know the incredible examples in Latin America with Argentina, with Mexico, with Colombia, all increasing abortion access among other sexual and reproductive health services, despite a long and fierce battle with the religious opposition. But we can't rest on these laurels. Our partners can't rest on their laurels either. I mean, I think about Mexico, and there's, while the Supreme Court established it as a constitutional right, it is very much up to governors and individual states in Mexico to protect and to codify at the state level the right to abortion, the right to contraceptives, and so on and so forth. So that fight continues, but there's also the opposition that, again, signaling to the US saying, well, the US had a Supreme Court ruling that made it a constitutional right, and 50 years later, they reversed it. So there is still some hope, and there is some global precedent for us to potentially learn from and do the same. So this is the long game. I think also, just with the US advocating for gender equality, for human rights, for healthcare equity internationally, this decision in the US that affects people in the United States is very much in contradiction with the values that we are advocating for abroad. And it's not stopping with abortion. We know that here in the US, we also know that abroad, that this could lead to, and we're already seeing setbacks beyond abortion. We're seeing threats from those who are part of anti-gender movements, who are part of anti-democracy movements, who are part of anti-rights movements, really looking to instate governments that are on the anti-rights side. I wouldn't say conservative governments, I would say anti-rights governments, because I think that's a misrepresentation globally of what conservative governments are. We're talking about governments who are against the rights of human beings, against the rights of LGBTQI communities, and especially those who are not respecting and prioritize the need to fight stigma, discrimination, and violence. This opens the door to ask the questions that extend far beyond abortion. And as I said, we're seeing it here in the US, we're seeing it abroad. Everything from should young children receive comprehensive sexuality education? Should we provide reproductive health services to teens? And so on and so forth. Things that should be basic fundamental, because knowledge and information is power, but even that fundamental commitment and desire to share information so people know what is happening to their bodies. When there's an abuse that could be occurring, people want to shut those doors down. So I think it's very concerning. And as I said, this is the long game for us.
Thank you so much for that. I think another question that I do have for you both is, how can global health professionals, whether they're in the US or abroad, work to make sure they're supporting the right to abortion? Maybe we go to you, Lucia, and then Pinabiha.
That is such a fantastic question, Lanice, and I think what Nabiha was saying about this is a long game, this is the long game, is something that we must remember, right? I think there's a lot of very interesting initiatives that I think global health professionals are already undertaking, and I really want to congratulate a lot of efforts by some of my colleagues in the US that have, like, among other things, created spaces for kind of like cross-regional pollination of strategies and ideas. I think something that was very, very wonderful to see was events related to like the Green Wave coming to the US, in which activists from like different regions came together to discuss what are the common challenges that we're facing at the moment. As Navi has said, like the opposition is very well articulated. And we also had the opportunity to learn from people that work in extremely difficult conditions, like people that do work in El Salvador, people that do work in Nicaragua. I mean, countries with destabilized governments, and as Nadia was saying, like anti-rights governments that are like actively opposing the guaranteeing of human rights. And I think that for me, it's something that global health professionals could be fostering. I think there's a lot of learning to be done. There's a lot of like years of experience of activists that have developed a series of strategies. And I think as we think of this as a long game, I also think it's important to think about this like multi-layered game, in the sense that legal reform is super important, policy reform is super important, harm reduction practices are super important, dissemination of information, kind of like the social decriminalization that many civil society organizations have invested in Latin America, that have then facilitated a larger like legal reform project. But this like very small work of every day showing up for the communities, meeting people where they are, meeting people in the language that they speak, right? Like providing dignified access to care and like supporting those decisions irrespective of the legality of abortion, right? And in many ways defying how unjust abortion laws are. And I think that is something that both in Europe, in countries like Poland, but in countries, networks in Africa and networks in Latin America have done so beautifully in this like past decades. And I think the privilege that we have as global health professionals, as people that are active in international spaces, is really start weaving, start connecting, start like creating spaces for this sharing, that I think it will really make us bolder, make us feel that we are in this fight together, and definitely provide some support and solidarity to the US activists.
Lucia said the magic word solidarity. And there's so much magic that she said on this call that I so appreciate and inspired by. But solidarity, I think that's absolutely essential, is the importance of healthcare professionals, and those that healthcare professionals connect with and inspire, that we stay together for shared learning and shared exchange. There are always these moves and these efforts to disrupt and distract and fragment. And if you think about fragmentation, when that happens, you diffuse power, right? You've created chaos. And so this support and intentionality of keeping the ecosystem of healthcare professionals, of advocates, of allies, of activists together, it's more than just, oh, isn't that nice? But as Lucia said, from a solidarity perspective, it is absolutely essential, and we have to be really purposeful about that. I think the other pieces that are important in terms of answering your question, Lanice, are thinking about this both from short-term and long-term strategies. They need to be complementary, but we have to think about, what do we do and respond to in the here and now? What do we activate in the here and now? And how that feeds into the long-term strategy. Because that's, as we've seen with Roe, 50 years, and here we are again, right? The fourth is balancing the evidence and the research with the human impact, because we also know that, unfortunately, science and evidence and research may not matter to a lot of people in how they make their decisions. So we need to bring both to the table and show that cohesive, comprehensive picture of, this is what the data, this is what the research show, but this is also what the human impact is. And hopefully people are going to care for one or the other. Ideally, they should care about both. And bringing in others. I think we have to be very, very intentional about saying who is not at the table. And are we opening the doors, expanding our tent? It can't just be the brilliant and amazing and tireless sexual and reproductive health and rights advocates and the human rights advocates at the table. This work is really tough. And we have a responsibility to bring in others and also embolden others to carry those messages forward in a diversity of spaces. And last but not least, I think there has to absolutely be greater funding and prioritization of the work that advocates and activists do. There isn't enough. There isn't enough, and we can't be in a situation where those who are taking to the streets, who are pulling the data, who are doing the research, are doing it for free. Because free only gets you so far. We have to invest. Donors have to invest. Donors have to see that the only way to move the mountain and to make the prospects of people better are when others are speaking up, and those others need to be funded, because advocates are the truth seekers, the truth speakers, and the protectors of progress. And we need to keep fueling and supporting this whole movement so we can advance the progress that we all hope to see.
Thank you so much for that, Lucia and Nabiha. I think this is the portion of our event where we'll turn to our audience to see if they have any questions for our speakers. I did put it in the chat. Please do feel free to put any questions that you have in the chat for our esteemed panelists, and we'll be sure to make sure that they answer them. And I think while we wait for questions to come in, I think one last question that I do have for you both, Lucia and Nabiha, is, you know, this fight, this advocacy work on Roe and the impacts of it, not only in the US, but globally, is a long, steady fight. So I do agree with you about having both strategies that complement, that are long-term as well as short-term, but would love to hear, like, what is your vision? Like, what are you hopeful for? What would you like to see in the next, whether it's 1 year or in the next few years, particularly around seeing changes and ensuring that women have the right, because we know abortion rights are human rights. So we'd love to hear, like, what are you hopeful for in the future, and what would you like to see? Nabiha, you, and then Lucia.
I am very hopeful and inspired by not only all the partners that PAI gets to work with, and my team at PAI, and all of our coalition members, that we're together, we're still stepping forward, we're advocating, we're advancing what we believe is right for people, because people are telling us what they want for themselves. That is inspiring to me, is we're not letting up, and that gives me a lot of hope. I also have a lot of hope in young people, and I think that is an untapped opportunity, is seeing young people as more than just they are the future or they have an inspiring voice and let's make sure they're at the table. Young people are the ones who are on the front lines, who are not only driving change in the here and now, but they're going to sustain that change. And so I am inspired by how young people are showing up and being more aware and asking the tough questions, because that's what we need. That's what we need more of. Absolutely. And, I guess, for me, what I would love to see is that power be shifted. And power be shifted from the perspective of, at some point, those in power need to stop making decisions for us based on their own value systems. And they don't know our context. They don't know the context of my sisters in Mexico, my sisters in Pakistan. So what gives you the right to make decisions that are going to harm the lives of others? You don't have a right to do that. So that is something that I would be celebrating, is when the power shifts to where the decisions that are made that the investments that are made are rooted in the needs of people, because people know best, not those who are in the positions of power right now.
It's so wonderful to thank you, Lanice, for making us like dream a little bit, right? Like I think like sometimes when you're in such a difficult scenario, it's so hard to imagine what we dream of, and it's so beautiful. And I have to say that I'm always inspired by the relentless work of the partners that I work with. I had the pleasure to be in Argentina last week, in which I was in a table in which doctors, government, networks of accompaniers were sitting, sharing space, and thinking how better deliver abortion care to people with the recently adopted law, right? And I think it's just so beautiful, and it's a testament of like the importance of those synergies between different spaces. And I get this energy when I see the articulation and the learning that happens from activists to medical providers, from medical providers to activists. Like even before the Argentinian law, medical providers, really bold people, doctors that were interpreting what the right to health means and what the ground for abortion based on the right to health mean, with a very expansive interpretation, understanding health and this holistic concept. And they were really pushing the kind of like pushing the narrative and pushing like much more affirming and human rights based understandings of like what the law would say, right? And I want to turn, like, for example, to activists from the Mama Network in Africa that work in collaboration with pharmacists, faith leaders, community health workers that have developed materials on self-managed abortion in 11 different languages, in Kiswahili, in like, I mean, it's just like the effort in Braille, for example, right? Like the effort, the love, the commitment that people have to ensure that people have access to a safe, supported, dignified abortion. For me, that is what I want to see more of. And I think this beautiful thing that Navi has said, like, invest in movement building. Invest in these advocates, invest in the young people that are leading this change. And I think that is just, yeah, like what I would dream of, right? In my ideal world, we will have like a very strong, loud, bold, cross-sectoral movement, because I think that is something also that I would like to see, particularly in the US, in which the abortion fight has somehow been like disconnected from other struggles. Like where I come from, the struggle for abortion rights was very much connected to the struggle for universal healthcare, universal access to healthcare, right? Like very much connected to the right to make decisions on my own body, meaning that in that struggle, I share my abortion rights struggle with my queer community, with people that came from the workers movement, from the students movement, etc. Right? To like understand that abortion is part of a larger landscape of human rights that we must be able to articulate together and come together to demand. So if I can dream in a rainy day from foreign lands, I think I would say that.
Thank you so much. And I see we've gotten two questions and a comment. I'll ask the two questions first before, and then give you time to answer it before we close our event. But the first question is, there has already been so much documentation on advocate-led social networks and cross-border movements around medication abortion. How do you see those expanding in the light of the recent FDA changes? And do you see advocates in countries you work preparing or thinking about that? And then the second question is, it feels like Roe v. Wade has made a U-turn. How do we get back in the right direction? And where are the voices to put us back on track? And then Nabiha, maybe we start with you and then Lucia.
Sure. On the first one, I think the FDA also has an outsized influence. There are a majority of countries around the world that may have medicine available in their own countries if they see that the FDA has approved. So I think this further raises confusion of the FDA being the authority in the United States that is ensuring to put essential medicines or any medicines on the market if they are safe, efficacious, and effective. So it's a little too soon to see what the implications are going to be, but there's certainly a lot of conversation around this. I think we absolutely have to get out in front, and our partners are saying the same, of getting out in front of their own policymakers, their own legislative bodies, especially in countries where medical abortion is available, to say this is safe and effective. Let's look at the data. The decisions in the US are very much politically motivated. They're not based on science. They're not based on evidence. So we need to be prepared to share those tools in a way that is, and that information in ways that are very accessible. So I'll stop there on the first question. Lucia, perhaps you've got an additional perspective on this.
Yeah, I think exactly as you said, Nabi, like we look at the FDA in a way as this kind of like authority, with an impact in some countries, and I think we definitely need to get ready about that. What I do want to stress is that I feel like this is not the end of the fight. I think the anti-rights have targeted the medicines just because self-managed abortion and medication abortion became even more visible. I think they have also targeted people supporting each other, right? Like think of the case of Texas, for example. So like they have gone to kind of like tackle, like kind of like try to create this, I mean, not only legal uncertainty, but also like disseminate fear with regards to when it comes to medicines, or the medicines are unsafe, which is completely scientifically not sound, and that supporting each other can land you, can get you in trouble with the criminal law. And at the same time, the dissemination of information is restricted in so many ways. So I think like this, like kind of like multi-targeted, complicated legal strategies that they are doing, that have to do with the FDA, but that have to do with other things, are just, the objective is to generate chaos, uncertainty, and ultimately conservative readings of the law, and to make people and advocates and medical providers like to be in fear, right? And I think we must be prepared to fight that, and to understand that the issue with the FDA fits in like a broader landscape of a strategy that ultimately what it wants is to deprive people from like having autonomy on their body. So like, do I think that advocates elsewhere or in the US are preparing and thinking about that? Definitely. I've seen a move to like further document the work that activists elsewhere are doing with mifepristone, and like people accessing mifepristone via telemedicine, for example, in the UK, for example, in France, in many different jurisdictions, being able to like prepare themselves with like evidence and arguments to be able to counteract the potential effects of this legal chaos that the US is living at the moment with regards to the mifepristone. But I just want to be very clear, like, yeah, it's just like the drugs have been in the list for a long time. People all around the world in many different jurisdictions have been using it safely for decades. So I think we must also like try to draw from the evidence from those places.
Thank you for that. And I'll hand it over to Suba to give our closing remarks and key takeaways.
Yeah, absolutely. Thank you both for this dynamic and interactive conversation. I think, I came in expecting one thing, and I've come out with a whole host of new things to think about. So I want to thank you again, Nabiha and Lucia, for both representing your organizations, but also representing, speaking on behalf and uplifting all the work of advocates and your civil society partners that you're all working with. What I'll take from this is that, anti-rights movements they're working in the way that they have been planning for a very long time. And so we are sort of in the driver's seat, needing to buckle up and start to think very critically about how we, one, expand the tent, because anti-rights movements are anti-rights, not just in the case of abortion, but in the cases of many other rights. And who do we bring, who has been underrepresented or whose voices have been ignored? So critically expanding the tents that sometimes, and even our tables, and including people that maybe before have not been allowed a seat. I also just want to uplift that these 2 points, the advocates are the protectors of progress, and then also an investment in movement building is an investment in solidarity and for all of us. I just am going to come away from this conversation actually uplifted, and I really want to appreciate you all for that. You've touched on a lot of different things, but I think all of the folks on this webinar are doing amazing things in their own organizations. And I just appreciate both of you all for all the work that you're doing currently to continue to expand and support sexual and reproductive rights, and especially abortion rights, both domestically and globally. Thank you, Lanice, for all of your wonderful questions and for your work as the moderator today. Thank you, everybody. I guess we'll close there.